So there's broadly speaking 4 types of patients we tend to see present to our chiropractors and physiotherapists here at the clinic. One being those with no pain or injury whatsoever, individuals who are purely looking to legislate against development of pain and injury and look after their musculoskeletal system in the same way that we look after our teeth. And we're all really familiar with seeing a dentist, but people are now cottoning on to the notion of, well, I look after this part of my skeletal system, why am I doing nothing with the rest of it? So that's sort of group 1 of patients. Group 2 are those presenting with simple orthopedic or neurologic problems, back problems, knee problems, shoulder problems, headaches, etc., etc. Then there's professional sporting patients, and they're all super fit and healthy, usually very little wrong with them, but the main reason that we'll tend to see them is if they've got something they don't want to present to their club. And then right on the other end of the spectrum, we've got what we call our chronic and complex pain patients. And these are the more long-standing cases. Very often patients will have had a whole raft of surgical procedures, they'll have seen a whole host of other clinicians beforehand, and they might be on a range of pharmaceutical drugs to help manage their pain. Now, the reason that I mention these 4 cases is to emphasise the fact that even though they're all really different, the first step that we want to take with any one of them will always be near identical, and that's to make as much of a clear-cut and thorough working diagnosis as possible, to really hit the nail on the head with exactly what's going on from the get-go, because that's ultimately what's going to determine whether we travel north, south, east or west with regards to the management of somebody's case.